Hi, my name is Dr. Daniel Fox, and I'm a licensed psychologist in the state of Texas. And today I wanted to focus on a treatment for anxiety disorder. And this is a treatment that I use with a lot of my clients. It helps them to sort of understand their anxiety as well as challenge it and overcome it. And I've created a worksheet that I also use with my clients that you might find helpful as well. So, and that will, a link to that will be in the comment section of the video. So this treatment is what I called ACE. So it's ACE treatment for anxiety. And the thing that I tell my clients a lot about anxiety is that anxiety is a lot like a stray cat. Okay? And the more you feed it, the more it hangs around. And when you stop feeding it, and this is when folks, they start to challenge it a little bit and some of the strategies that we're going to focus on. But I want you to be aware that when you start to do things differently and you stop feeding your anxiety, the anxiety can kick up a little bit more, right? Like that stray cat comes around a little more. You see it more often. It's looking for the food. It's looking to be fed. And your anxiety is the exact same thing. But what happens is, just like with the stray cat, when you stop feeding it, eventually it goes away. Now, that doesn't mean that someday that it may come back, but if it comes back, it tends to be for a shorter period of time. And then when you don't feed it, it goes away again. And if it comes back, it's for a shorter period of time. It's less severe. It's less of a nuisance, and you have greater control over it. So I think that's a good conceptualization of working with anxiety and understanding anxiety. So let's get into the ACE treatment. So when we talk about ACE, so the A in ACE stands for accept. You have to accept the fact that you're anxious. And what happens with a lot of folks is that when they become anxious, that they want to fight the anxiety, they want to resist the anxiety, they want to put a lot of energy into trying to control it. And what happens is the harder you push against it, the more energy you give it, and the more intensity you tend to experience. So with a lot of my clients, what we do is we take that out. We accept the fact that they're going to be anxious. And in the worksheet, you'll see that it says that I accept my anxiety makes me feel, think, and behave. And then you would describe that. Okay? Because the more details and the more exploration you can do into your anxiety, the less power it has over you. So we want to empower you to control that anxiety, okay, and have a greater understanding of it. So that's A. A is accept. We talk about C, we talk about challenge. It's about challenging that anxiety. Now, in the worksheet, there are several challenge statements that I put in there to help you out. So how will you challenge your anxiety? Will you do it by doing deep breathing? Hey, because when we do deep breathing, we do relaxation techniques, mindfulness, which is also another challenge technique, that it takes away from the intensity and the power of that anxiety. And it's exactly what we want to do. We want to lessen the intensity and the power of that anxiety. We want to challenge. We've accepted it. We've taken a little bit of power away from it there. Then we want to challenge it. We're taking more power away from it. And we do that by deep breathing, mindfulness techniques, watching a funny video, whether it's on YouTube or anything else. Myself, I like Seinfeld videos. So if I feel myself getting anxious or worried about something, sometimes I'll take a break and I'll watch like a Seinfeld video for a little bit. And I find that that helps me relax. Exercising. And for my clients that have chronic issues of anxiety and severe anxiety, when we talk about exercise, I usually tell them exercise to the point of exhaustion. Exercise as much as you can is what's appropriate for you and your body type. But to the point of exhaustion where you're so tired, you have no more energy to deal with your anxiety and you're burning out all of that anxiety. Another one is saying something positive about the moment that you're in, about what you feel anxious about. What's a positive? Digging deep. And this can be hard because it's some counter technique. It's a counter strategy to that anxiety that a lot of us don't do, but it can be really helpful. And then the last one, if your anxiety is centered around a physical ailment, talking to your doctor about it. I encourage a lot of my clients not to look on the internet to try to diagnose themselves. I think that the internet, although it has a lot of good things, I think for medical information, psychological information, it tends to be distorted. So talking to your doctor, talking to a nurse practitioner, to a medical or mental health provider, if your concern is related to a psychological issue, is getting it from that source. The internet tends to be skewed with all kinds of different stuff, and all that does is kick up your anxiety, but we want to challenge it. So we want to go directly to a reliable source, okay, and get that information. Okay, so that is C. C is to challenge. Now, E is to evaluate. Okay, so you have to evaluate your anxiety. And I have 9 statements in the worksheet to help you evaluate, right, your anxiety. Okay, and these questions are, so the first one is this something to really worry about? Is this something that you really need to worry about? A lot of times anxiety pushes us to believe that things have to be instantaneous. It's something we have to deal with right away. And if we don't, the whole world's going to come crashing down. And there's actually been statistics on crises and other types of like severe instances we may be in. And what we find is about 1% of all the experiences that we have are actually life-threatening or immediate instances. And 99% of the other ones are ones that are not dire. So it's important to remind ourselves of that. So ask yourself that question, right? Is this something to really worry about? Okay. Another question is, has this worry occurred before? And if it has, what is it as bad as you thought? Okay. Let me see if I can get that out. And then another one is, right, what can you do to manage this situation and manage the fear? What are some questions, some challenges that you can pose to yourself? How have you managed it before? What can you do to challenge yourself, to challenge that fear and to deal with that situation and manage that situation effectively? Okay. Another one is this from my past affecting me in the present? And sometimes what happens is we may have memories, we may have traumatic memories, traumatic issues. And if it's something that is associated with your past, perhaps you've been to therapy, perhaps you know some techniques, utilizing those techniques. If it's from your past, make sure that you're centered on where you are today and the issues that you're dealing with today and not get pulled back by emotional buttons, by other issues that pull you back to your past, so you feel like you're dealing with the past today. Today is today and yesterday is yesterday. Granted, there are things that a lot of folks have been through that continue to stick with them. And the best way to deal with those is to be present-centered and deal with where you are today. Okay, and I know that that's easy to say and hard to do, but I think that that's important as another way to challenge your anxiety. Another one, is this worry likely to come true? Is this a genuine worry that is likely to come true? How real is it? Um, Another one would be, if the worst happens, okay, what would be so bad about it? What would be so terrible if the worst were to happen? What is the worst case scenario that could happen? Okay, and then you can ask yourself, well, how would I deal with it if this was the worst situation? How would I deal with that? Okay, what hard data do you have that your anxiety is warranted? What hard data, what facts do you have that your anxiety is warranted and justified right now at this point in time? Okay. There was 2 left. And then what would solve this issue? So how problem solve some stuff. What can you do to lessen this anxiety? And your anxiety wants you to say, well, nothing, there's nothing I can do, and make you feel helpless. So you will succumb to the anxiety and do what it wants you to do. And if it's that stray cat, what does that stray cat want you to do? Feed it. Okay. And the last one is, now, what can I do to solve this issue? Okay. What would solve the issue and what can you do? So what can you engage in to solve this issue? What are some behavioral steps that you can engage in to lessen this anxiety? And all of these challenges are to help you gain control, because it's when we stay away from it that anxiety builds and it has greater control over us. And that's exactly what we want to do. We want to have control over it instead of it having control over us. Now, at the end of the worksheet, you'll see that after you went through these steps, you're going to rate your intensity of the anxiety. And the more you do this worksheet, the more that you challenge your anxiety with my clients, is that we have found that their anxiety goes less and less and less. And they feel this greater sense of empowerment. And I put a little reminder about the stray cat on the bottom as well. I don't normally do videos outside. I thought I would do something a little different, so there were some noises, so hopefully you could hear me and everything was fine. Again, I thought this would be a nice kind of calm atmosphere that can help you learn this technique, see this technique. You've watched this video several times if that would help you. I hope that you do find this helpful. If you found this helpful, you're welcome to check out some of my other videos or subscribe. That would be great. And thank you very much. And I hope the ACE technique is helpful for you and to lessen your anxiety. Thanks, and have a good day. Bye-bye.